Hello, welcome you. I am Dr. Panchanan Khakhlary. I am MD Medicine working in VKNRL Hospital, Numaligarh, Golaghat in Assam. So today to my viewers, I am going to tell you about the global pandemic that is going on, that is COVID-19. As you know, most of the diabetic populations, they are having a lot of problems as they are not having proper access to health facility, as our country is going on lockdown for last 1 month, and it's still further another 10 days left for it. And we are still not in a position of having any proper medicine to prevent the disease, or there is still now no evidence of any proper vaccine that is available to counter it. As you know, that till now around 27 lakhs people have been affected globally, and it is headed by United States of America with over 1.9 lakhs people dead. And in our country, almost 23,502 people are affected right now today, with 722 people are already dead. And in our scenario in state of Assam, already 34 people have been affected by COVID-19, and hopefully only 1 people died. Coming to those people who are having diabetes, as it is a very common disease. Every 1 person in 3 out of 3 in our country is diabetic. So those people, they are not having regular checkup right in now because of the lockdown and lack of other facilities. That's why there may be a lot of question arising among those patients, and any sort of conditions is going on. As you know, the diabetic itself, it is a disease which decreases the immune system of the body. So if you do not control your blood sugar level properly, you might have severe infections. Even if you are affected, you will have a lot of complications and risk of dying will be high. But there is no need to panic. Actually, you can prevent it, because in the our media and all government advertisement, you have been getting how to take your maintain proper hygiene and the barrier methods. So this should be followed like all other common people. This population should also strictly adhere to those guidelines. But regarding their disease part, first thing is that like any other diabetic population, this population also, you have to control your sugar. So you try to maintain your sugar level in the fasting in the range of 90 to 130, and the postprandial in the range of 140 to 180, unless there is comorbidity. Or in case of aging populations, we might have to keep the sugar level towards the higher side. And in case of those young and not having any other comorbidities, you can target it towards the lower side. So you have to minimize coming out for regular checkup. So if you have glucometers, you can easily do it at your home, and you can consult if the teleconsultation facility is available, or you can have digital prescription. So you can consult your doctors according to that. But if you have severe infections or other comorbidities, you might have to change your prescriptions. Those are on oral hypoglycemic. You might have to convert into insulins. So in those situations, you have to go for hospital and treatment. But otherwise, as you know that if you are exposed to disease, as there is no treatment, it is better that you contain yourself at your home with proper maintaining the daily your diet, exercise, and the drugs, and the monitoring of the sugar, that is self-monitoring of blood glucose at your home. So regarding the exercise, you know that we are not, because of the lockdown, we are not allowed to go out. So as some exercises like climbing or jumping or skipping or climbing in your stairs, or if you have a treadmill, you can do that. or those do not have, or if you have any chest pain or those things, then you should avoid it. And if you have proliferative retinopathy, diabetic retinopathy, this is the dreaded one, you should avoid standard exercise. Regarding the diet, you should maintain the diet as you have been advised by your physician or the dietitian. You should cut down on the free carbohydrates. You should take more of the complex carbohydrates in your diet. Then there should be protein in moderation. Then you should take plenty of vegetables, green leafy vegetables as far as you can, and you should keep your fruits almost 2 to 3 servings in a day. And regarding the care of the food, you should not miss this point. You should check your legs daily, and you should clean your legs very nicely. Then those who are having blood pressure, also high blood pressure, if you have a blood pressure machine or you have a digital machine, you can check your pressures, and it should be in an ideal level, say 120/80, those without any complications. And if your target is not met with your prescribed medicines, then only you have to go and seek the uh, help of the doctors. Otherwise, unnecessarily at this hour in the pandemic, you should restrain yourself for moving outside. And regarding, there are a lot of confusions that certain drugs, whether we should take or not. You should continue the medicines as long as you don't have any problem, and you are maintaining the blood sugar level. You continue the same drugs, and you have to hydrate yourself. The fluid is very important, because if you are dehydrated, you are likely to have diabetic ketoacidosis, or you can have lactic acidosis and other things. Those who are having on say metformin, so such things should also be taken care of. And it is the preventive measures which will actually help you. So you need not panic. You take your care of your health, daily take healthy diet, do minimum of exercise which is possible, take your medicines regularly, take care of yourself, take care of your family, maintain the social distance, as Government of India has asked for wearing of mask compulsorily while you are going out. So you maintain all these things, then you will be, I think you will be able to overcome this period. And you have to continue your all these measures, because it is going to last long. We don't know how long it will live. So stay healthy, stay safe. Bye bye.